All right, everyone. Today we're going to be discussing massage for stress and avoiding burnout as a massage therapist. I use your book a little bit during this lecture. If I do reference the textbook, it's going to be your Mosby's Fundamentals of Therapeutic Massage. We're using the 8th edition. All right, in chapter 1, it has a stress assessment section talking about you need to ask your client questions related to stress, beginning with asking the client to rate their stress. And that can be on a 0 to 10 scale or using a reliable stress scale that you may have received from like a mental health center. Ask how the client feels stress in the body. This one is super important to you as a massage therapist. Are they someone that grinds their teeth? Do they feel it underneath their right shoulder blade? Do they feel it in their low back? Ask the client if they have headaches or a tight neck and shoulders or low back pain. Ask the client to rate their sleep quality. Sleep and stress have a strong correlation to each other. These questions can help guide the treatment options and may help facilitate change. We hear it all the time. If you're stressed, get a massage. A massage will relax you. Well, what is relaxation? Relaxation is a general, all over feeling of well being involving mental and physical relief after effort. Massage is usually tranquil, soothing, and comforting if we are going for the outcome of relaxation. All right, relaxation is a physiologically inclusive process involving functions of the parasympathetic autonomic nervous system, which supports recovery from daily life activities. So, we definitely want to be activating the parasympathetic system with our relaxation massages. Um, Specific massage related interventions are minimal. You just want to be soothing and calming and make sure that you are giving them a pleasurable sensation in order to promote the function of wellness and well being. All right. Now, what is super cool is that there are multiple studies that have concretely identified the relationship of comfort care and general relaxation related to massage therapy. We can prove on paper and with medical studies that massage does indeed induce a state of relaxation. Right, some important things to note for yourself, but especially for the MBLEX. The hormone oxytocin is involved in pair bonding, parental bonding, both of which support positive health states. Oxytocin increases as a response to massage. It is your feel good chemical. All right. Serotonin is a mood stabilizer. It's another important neurochemical related to stress levels. The more you have of it, generally, the less stressed you are. Whereas cortisol, the more you have of that, the more stressed you are. Touch deprivation leads to negative health status and lower oxytocin, and the positive effects of affective touch are health enhancing in individuals because you are reducing their stress and increasing oxytocin and serotonin. Several studies have suggested that affective touch stimulates pressure receptors under the skin, which in turn leads to increased vagal activity, reduced stress hormones, and increased natural killer cells supporting immunity. All right, we've talked about this when we spoke about HIV and AIDS massage. Studies have now shown that massage does increase oxytocin levels and does definitively reduce stress hormones. Based on this evidence, massage therapists can confidently state that massage supports relaxation and promotes well being in individuals who find massage therapy pleasurable. All right, that's important. If someone does not find being touched pleasurable or massage pleasurable, it is going to increase rather than decrease their stress levels. All right, I know I have brought up the Miller School of Medicine, the Touch Research Institute before, especially in my anatomy classes, but it is a super cool place to go play in the archives of these touch therapy studies. This one was on pediatric massage, showcasing that underlying mechanisms for massage therapy effects increase vagal activity and decrease stress hormones. This was another study done on massage for NICU nurses rather than on pediatric clients. It's on the nurses who support them. And they found that just 2 weeks after intervention began, their overall job stress scores were significantly decreased when receiving massage compared to the control group that was not being massaged 20 minutes twice per week. In chapter 5 of your book, there is some information about stress management. All right. Stress is the emotional and physical way in which we respond to pressure and demand to respond. All right. Stress is a physiological response that enables people to cope with strain and anxiety. Stress management strategies support a normal stress response and prevent, control, or reverse stress related pathology. Stress will rip your body apart. All right. A lot of people use massage to manage stress. But as the stress increases, pathology can develop in the body, resulting in anxiety and depression, so there's more to combat. Physical symptoms of stress include rapid heart rate, muscle tension, headaches, low back pain, digestive upset, and a ton of other symptoms related to changes in the regulation of the autonomic nervous system as well as the endocrine system. Your homeostasis gets all out of whack, all right? A lot of addictive behaviors like overeating, all right? We're trying to fire that pleasure center in the brain, smoking, drinking, abuse. These are all linked to a stressful lifestyle. And a lot of times clients are trying to self-medicate with these things. Ongoing stress can also increase blood pressure, the risk for stroke, and it contributes to a lot of diseases like heart disease, diabetes, and multiple autoimmune conditions. A lot of studies are being done on the instances of like lupus and fibromyalgia potentially occurring after a lifetime of stress. All right, the body's response to stress is the general adaptation syndrome. It's divided into 3 stages. You have the alarm reaction. All right, this is the fight or flight response when a stressor occurs, and this is the body's initial reaction to a perceived stressor. Then you get the resistive reaction, all right? This is the secretion of regulating hormones. This reaction allows the body to continue fighting a stressor long after the effects of the alarm reaction have dissipated. So in stage 1, you freak out, you get scared, your adrenals kick in, you're getting epinephrine, adrenaline in your system. And then stage 2 happens, the adrenaline stops, but now the cortisol comes in for the long-term stress response. Then you end up getting the 3rd stage, which is exhaustion reaction. And this reaction occurs if the stress response continues without relief. It's unrelenting. Maybe you have a difficult relationship with reactive children. Maybe you have an extremely stressful job, whatever the case may be. It is unrelenting. Life is relentless sometimes. The body has various mechanisms for the maintenance of homeostasis. It does become more difficult in the exhaustion reaction, though. Reversing the stress response can be divided into reactive, and this is the stress response begins using feedback loops for counter regulations in the body, or predictive. These are anticipatory processes for future potential stress. The bad thing about anticipatory anxiety is you are worrying about things that hasn't happened yet, but your brain doesn't realize it, and your body will have a physical response to things that are currently not happening. So if you're worried about getting fired, if you're worried about something potentially happening at work or at school or with your kids or with your spouse or whatever the situation is, you are creating a homeostatic imbalance in your body as well as physiological responses to a stress that hasn't even occurred yet. So really try to pay attention to hypervigilance and worrying about things that have not occurred yet, because you are creating a very real response in your body. All right, there is a major difference in homeostasis regulation for eustress, which is good stress, versus distress, which is bad stress. All right, either stress does take a toll on your body, but distress hits you a little bit harder. There are stress management techniques. that can definitely help, including massage, which will increase your oxytocin. And remember, oxytocin is related to those feelings of well-being, connectedness, and bonding. And massage, as a mode of touch, increases that and reduces adrenocorticotropin, which is a stress-related hormone in humans. So part of the reason we keep warning you guys as students all the time that you are touch therapists, not talk therapists, isn't just because some of your clients will have the tendency to overshare with you, and because of the intimate setting of the room, you might cross professional boundaries and have a tendency to overshare as well. It's also that the therapeutic relationship established between the massage therapist and the client is very similar to the developments that occur in psychotherapy, right? We see transference and countertransference in both fields, but also a lot of researchers believe that the effects of massage on anxiety and depression stem from a positive therapeutic relationship like you would have with a psychotherapist, all right? One thing to keep in mind is massage is not always the best way to manage stress symptoms. Although massage is effective for managing pain and anxiety, it's not necessarily more effective than other relaxation interventions. If you're someone that likes to go jogging while listening to loud music and zoning out and getting that endorphin hit from running, that might be as effective or more effective to you than massage if you're not someone that likes being touched. All right. People that like massage, this is a crucial factor. I know I've brought it up already at least twice, is crucial that they enjoy massage to be compliant with treatment and having it reduce their anxiety. All right. Other studies have shown that massage therapy enhances treatment course of hospitalized oncology patients. That is pretty awesome. They found that therapeutic massage shows potential benefits for reducing chemotherapy and radiation side effects. So physical issues that are happening are being helped by massage in people with chronic illnesses, devastating illnesses, which also helps bring about a little bit of stress reduction as well. All right. Anxiety has been shown to be reduced in acute cardiac care clients, people that are undergoing a type of heart condition or have ongoing cardiac care of some type. Their anxiety levels have been shown to reduce with massage therapy. All right, back to the book, chapter 3. We're going to talk about burnout. When a person is burned out, their motivation is lost. Burnout occurs when you use up your energy faster than you can replenish it. All right. There are three main reasons that burnout happens in the massage therapy profession. That is physical fatigue and injury, that is financial strain, and emotional stress. Physical fatigue and injury are usually caused by ineffective and excessive use of the body while giving massage. All right, it is reasonable to expect that a massage therapist can work about 40 hours a week, but 25 to 30 of that is actual hours of massage during that time. This is a full-time massage practice. Do not do what Mrs. Ellis did and do 50 hours of physical massage per week for years, or you'll blow out your thumbs. And let them recover by becoming an instructor for a while. Absolutely take care of your body, body mechanics, stacking your joints effectively. Do not overuse yourself. Learn to manage effectively. Massage therapy is a service business, all right? And income stability depends on client satisfaction, retention, and a full appointment schedule. So the bad thing is if a client cancels an appointment, it creates a reduction in income. Sometimes if you're employed and paid by the hour, you get paid anyway, and the business owner absorbs that loss of income, like if you're at a spa. But if you're self-employed, you have to deal with the deficit. There's no one else providing that payment for you. That burnout issue attached to financial strain occurs when the income barely covers personal expenses and there's no financial safety net. So it's obviously really stressful to live from paycheck to paycheck. So if you're burning out your body and now you have no income to show for it, you've got two reasons to be burned out. This is a chart out of your book. It's a little bit outdated. I know that federal laws keep changing and state laws in terms of work shift breaks that are legally required. Um, there is just some suggested work breaks and meal breaks here and non-massage hours worked per shift. I suggest that you check it out. If you were interested in that, most therapists work 3/4 of the time, which is 25 to 30 hours worked per week, with only 20 to 25 hours of actual massage time, versus full time, which is 25 to 30 hours of massage, which means 10 to 15 hours of your work week is doing non-massage activities, whether that's selling product, teaching a class, doing the laundry, cleaning the office, things of that nature. All right, we talked about physical burnout, financial burnout. Emotional stress is the third big one for cause of burnout. This is characterized by taking better care of others, people pleasing, and offering that service without focusing on yourself. All right. Burnout can be a problem in most service professions, not just massage therapy, because taking care of others is a big job. CNAs, hospice workers, you name it. If we do not take care of ourselves, though, we soon have nothing to give others. All right. The actual application of massage is basic, usually repetitious touch, which sometimes can get boring. All right. It is important you keep yourself excited about the benefits of such repetitious applications of touch. Using myself as an example, I was a director of a spa for quite some time. I did massage work in a spa probably for close to a decade, although much longer than that, I have done work in either medical or chiropractic settings, because that gives me a definitive focus. A client comes into a medical setting with a distinct problem. I am a puzzle solver, a solver. I love to work on their problem and see definitive results from working on that problem. So working in the spa environment is definitely not for me. It's much more relaxing for sure, but it's also much more repetitious. So it really depends on who you are as a person and what you find relaxing or interesting, or you're getting some type of value out of the service that you're giving others, because spa is phenomenal for making people feel decadent and relaxed and taking them out of their normal life. Whereas medical work, you're really putting them in touch with one of their really hardcore current complaints in their life and their body. So it's a very different feeling in the environment and office, not just for the client, but for you as a therapist. But you need to make sure that you keep yourself excited about the benefits, all right? One of the best ways to do this is continuing your education, whether that's learning new techniques that you could use, like doing a scalp massage. If you ever train with like a Veda, using a Veda blue oil is absolutely amazing. Take classes that make you think and bring you together with other massage professionals to brainstorm about things that you can do. These are good opportunities to share and learn together. It's also important to take a break from massage for a bit. Have a hobby that is not related to massage. Create downtime, creates balance. All right. Take care of yourself. Let others take care of you when they offer to. Take a vacation when you can. Take a walk. Take a long, warm bath. Burnout will be less of a problem if you can kind of take yourself out of the massage field for just a moment and regroup and pay attention to yourself. All right. Living with purpose is the key to maintaining your motivation. It means drawing strength from knowing what we have to offer our clients is valuable. All right, what happens when the burnout cycle begins? You end up getting chronic stress, then you get that emotional exhaustion, then your performance gets reduced, then you feel guilt and shame about it, which causes further stress. Burnout is not just about being tired, it is a profound erosion of passion, energy, purpose, motivation. You're just done. Massage therapists are at a high risk due to physical factors, emotional factors, and systemic stressors, which is a lot of the financial burden in the way that the industry is set up. Prevention requires healthy boundaries, not just professional, but personal boundaries. Self-care, taking care of yourself, and systemic change, making sure that you're getting a fair pay and that you are being given a realistic schedule. So let's dive a little bit deeper into the physical and emotional stressors of getting stressed and potentially burned out as a massage therapist. All right. Physical stressors can be repetitive strain injuries. This is overuse, usually in the hands, wrists, or shoulders, like getting carpal tunnel, tendonitis, thumb overuse from deep tissue work. I feel attacked. Poor body mechanics. Improper table height is a big one, especially if you're working in a place that doesn't want you to adjust the table height. Your leaning posture over the table. How are you standing over your client? Improper alignment. You're not joint stacking with your back or neck, causing pain, shoulder pain, neck pain, chronic back pain. Spending long hours on your feet can lead to fatigue, varicose veins, plantar fasciitis if you're not careful. Make sure you're wearing comfortable shoes, please. Sensory overload. You are constantly touching people, smelling scented oils, scented lotions. Low lighting can exhaust the nervous system. You're constantly straining to see things in there. The burnout link here is persistent pain reduces job satisfaction and increases your level of absenteeism. In terms of emotional or mental stressors, you can get what's called compassion fatigue. This is when you absorb clients' pain and trauma without adequate decompression. You do a lot of emotional labor, especially with trauma clients, mental health clients, clients who just have a tendency to talk throughout their massage. This will all wear on you. Boundary challenges. This is clients oversharing, demanding extra time. Oh, please, just 10 more minutes, even though you're on a tight schedule, or crossing professional lines. Hey, do you want to have a coffee? Can I have a hug when we're done? Vicarious trauma. This is secondary trauma. We talked about this in the trauma lecture from working with abuse or trauma survivors. Chronic pain patients constantly talking about the way that the pain hurts and affects their life. Absorbing client stress or holding space all the time for emotionally distressed clients. Even though you care about your clients and you want to do this work, it still takes a toll on your system. You also can have performance pressure, fear of negative reviews, or unrealistic clients' expectations. That's why informed consent in the intake process and setting realistic client expectations is so vital. Emotional exhaustion. You can feel drained after sessions where the clients start crying or venting or they require emotional support. Again, you can hold safe space, but you don't give advice because you are a touch therapist, not a talk therapist. The burnout link here is that emotional depletion leads to detachment from your job, from your clients, from your purpose. You just don't care anymore at that point. There are also work environment stressors, just like with most jobs, all right? You have an unpredictable income a lot of times in massage therapy. You could have fluctuating bookings, clients canceling at the last moment, especially if you don't have a no-show fee policy in place. Self-employment financial stress, you could feast or famine. So, like, you could have people flooding in for the Christmas season and then it's dry for 3 months. Spa or chain franchise therapists often earn quite a bit less per hour than independent practitioners or ones that are working for higher end resorts or for medical facilities. Scheduling strains. What if you're overbooking or you have back to back sessions without breaks so you don't have time to stretch or rest or eat or hydrate properly because you don't want to drink too much between one client because then you're going to have to go to the bathroom in the middle of the next client. Clinic policies. There could be high pressure sales quotas with forced upselling. I turned down working for a spa fresh out of school because I absolutely cannot do sales. If I don't believe in a product, I cannot lie to your face and say that it's great. Sales is absolutely beyond my ability to do. I cannot do it whatsoever. So I cannot work in a chain spa successfully when being forced to do upsells. There could be excessive paperwork, a lack of support staff, super rigid schedules, lack of input in clinic decisions. You could also feel isolated, especially solo practitioners. You don't have those colleagues or coworkers to debrief with after a touch session or get mentoring or guidance on handling complex cases or business challenges with your clients. There could be a lack of benefits like no health insurance or paid leave or retirement plans, especially if you are independent. There are ways to set those up, but they are more difficult if you're working on your own, and sometimes they are not offered, especially in franchise locations. There is also stigmas around mental health. There's the pressure for a therapist to always be calm and relaxing, and you need to suppress your authentic stress expression, or people tell you you're a healer, you shouldn't be stressed, and there's shame in you seeking help because you're considered someone who helps others. Administrative burdens such as charting, marketing, billing on top of the hands-on work of massage. And so the burnout link in all of this is the chronic overwhelm of all of this extra, extra, extra. You can start feeling resentment towards the job or feeling alone in your struggles, which also leads to emotional exhaustion. There's also client related stressors. You could have difficult clients. This could be late arrivals, people no showing, they ignore pressure preferences in terms of you saying something like, hey, like you've been diagnosed with osteoporosis. It is, not safe for me to do deep pressure. And they keep demanding that you go deeper. Inappropriate behavior, sexual remarks, boundary violations, or aggression from your clients. They could have, frequent emotional releases, clients crying, shaking mid-session, requiring emotional labor on your part. Lack of autonomy and boundary with client demands. Now we're talking about your autonomy as a massage therapist, not the client's. You are feeling pressured to fix their pain in one session, even if that's not possible. Perhaps tolerate inappropriate behavior or take on last minute bookings or emotional draining clients to avoid conflict. Maybe you don't want to tell them no. Maybe whoever you're working for needs you to do it because this client is booked and they want to make the money and you're the therapist that's available. The burnout link here is feeling like you've got a total loss of control, helplessness, and you become cynical in the position. Some other factors here are maybe your personal life is getting in the way a little bit, or you don't have any work-life balance. You've got neglected self-care like skipping meals, poor sleep, no time for your own body work. Guilt over saying no, that's allowing that overbooking to happen because you don't want to say no and have your client resent you. Work-life imbalance, taking the stress home with you or struggling to turn off thinking about your workday. We've already talked about financial stability, but sometimes there's low wages in these chain facilities. All right, this is like less than 40,000 a year despite being a very physically demanding job. No benefits, which we talked about. If you're working on your own, there could be high overhead costs like rent, insurance, and supplies. And the burnout link here, of course, is money stress undermines the passion for the work. Misalignment with values is a huge thing. If you're prioritizing profit over client care, like you are being booked back to back to back 60-minute sessions where you are responsible for not only massaging the client, but cleaning the table, changing the linens, cleaning the office, using the bathroom, getting your water, talking to your client for the intake and exit interviews. Like, and then the client is still expecting to be massaged for a solid 60 minutes. That's a lot of pressure. Ethical dilemmas, working with clients whose needs exceed your scope, like they have untreated mental health conditions, leading them to consistently break boundaries, or a loss of purpose, like I used to love this work, but now it's just a paycheck. So the burnout link here is having existential frustration, and you're going to detach from the motivation you had to do this work to begin with. All right, so what are some ways that you can prevent or combat this potential burnout or manage stress as a massage therapist? Obviously, physical self-care, because this is a physically demanding job, all right? Proper body mechanics. Use tools, right? Use your elbows, forearms, or massage tools, right? Like little thumb savers to reduce your hand strain. Adjust your table height. This one's important. Make sure your shoulders are always relaxed and your wrists are neutral and you can stack your joints appropriately. Stretch between your sessions, all right? I've got a trampoline and a vibration plate that I use quite a bit for myself. Use pendulum swings for rotator cuffs for your arms. You can also do jumping to swing your legs out. Injury prevention, hydrate, 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 hydrate. That collagen, excuse me, not collagen, your cartilage needs liquid, 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 liquid to keep your tendons absolutely supple. Obviously, water helps with your collagen too, but your joints really, really need it, okay? Rotate modalities. Switch from deep pressure to craniosacral to reduce strain. If one modality will work just as well for an issue your client has as the other, do the one that is less strain for you if it doesn't matter to your client. Get your own body work, all right? Mental health therapists usually have their own therapist, trade with colleagues, or see another therapist monthly. Make sure you're taking care of emotional and mental self-care, all right? Set boundaries, time management. Make sure you've got at least 15 minutes between clients to reset, use the toilet, and limit back-to-back deep tissue sessions to give your hands and body a break. Redirect oversharing. Man, that sounds really tough. Have you shared this with your therapist? No unpaid therapy, all right? Avoid lengthy post-session emotional debriefs about the massage, all right? Just ask if there's anything that can be altered next time, how they're feeling post-massage and move on, all right? Processing secondhand stress is super important. Shake it off, literally shaking, which is why I have a trampoline and a vibration plate, because shaking discharges tension and resets your nervous system. Grounding rituals, wash hands with cold water, take 3 deep breaths between clients, splash your face. If you're not wearing a lot of makeup, wash your face with cold water. I used to keep lavender, vanilla, or rose. I really like rose for myself because you can't wear a perfume and stuff working on clients, but I did have facial wipes with like rose water in them because the scent really calmed me down, so I could just apply like a nice cool wipe that would give me some aromatherapy myself in between clients, all right? You could journal if you're into journaling. If you're someone that gets stressed out by writing, do something else. Listen to some music, dance for a bit, take some deep breaths, do something to decompress in between your clients. All right, what do you do when you start feeling like burnout is creeping up on you? When to seek help is when chronic pain or numbness starts showing up, or when you have an inkling that pain is starting to come in. When you start feeling cynicism or resentment towards your clients, this is a sign of compassion fatigue, so keep an eye out for that. If you are getting disturbances in your sleep because you're replaying sessions in your head, you're clearly taking your work home with you. That client should be on your mind from the beginning of the massage session to when they walk out, to when you're prepping again for the next time they come in. All of that in between time, unless you are researching something specifically for them, like a particular stretch or modality that you want to try with them next time, you should not be thinking about them, okay? Cut it off. They are to come in, get help from you for that duration, and then you turn it off thinking about them until prepping for their next session with you when you're reviewing those soap notes before they come in. All right? Get counseling for vicarious trauma if you need it. Physical therapy for repetitive strain. Go see a different type of body therapist to make sure you are taking the best care of yourself that you can. Remember, you cannot pour from an empty cup. If you have no compassion left, you cannot give compassion. Prioritizing your own well-being is not selfish. It is literally how you sustain the ability to care for others.